So there is still a very high unmet need in multiple myeloma, right? So this is still a disease that is fatal, right? And you have many patients suffering of it. So 50,000 patients every year are diagnosed in Europe, but amongst these 50,000 patients, unfortunately, 30,000 patients are still dying of multiple myeloma, right? And what we need also to know is that around 50% of these newly diagnosed patients do not reach 5-year survival, right? 5-year survival. And even amongst all the patients, almost 1/3 of the patients are not, surviving more than 1 year after the diagnosis. So you can imagine that's a very high burden, that's a complex disease, and this is something where every therapeutic option should play a role in order to improve the outcome for patients. I think, first of all, CAR-T is a fantastic technology, right? I've been a student in the early 90s, and I can tell you that at that time, thinking that a technology like CAR-T that could be available would have been something that looks like science fiction for me. And we're there, less than 30 years later. So that's a very complex technology, but a very powerful technology. And you will see that also with our CARTITUDE-1 results. We also achieve, for patients that have exhausted all options in multiple myeloma, we achieve 100% response rate, which is kind of unprecedented, obviously. Now, it comes also with some challenge. A clear challenge is the process and what we call the vein-to-vein time, which means that in order to manage CAR-T, you have to take the lymphocyte from the patient. These lymphocytes get re-engineered, so you basically insert the genetic information that will help the lymphocyte to recognize the cancer cell, which it cannot do if it don't get this information. And then having that, you will re-inject that to the patient. And this can take some weeks, and you have to really manage this overall process with a logistical complexity, but also the necessity to have the patient well treated and in a good shape to receive the CAR-T. To that question, I think we need to look at the result of the CARTITUDE-1 study, right? So what the CARTITUDE-1 study is telling us is that there is an unprecedented efficacy with the JNJ-4528 because 100% of the patients are responding to the therapy, right? And among this 100% of patients, you have 86% of patients that achieve a stringent complete response, which means that you cannot see the disease anymore, right? So that's absolutely unprecedented. Of course, such an efficacy and such a technical compound come also with, I would say, the need to manage some adverse event that can happen on the way. And one of them is the cytokine release syndrome. And it's pretty well known actually, because the cytokine release syndrome, that's one of the major complications of the COVID-19. So we may think, that's something serious, but the two patterns are really different. So the cytokine release syndrome that you observe with CAR-T is different than the cytokine release syndrome that you observe with COVID-19. And in the case of CAR-T, physician institutions are really well trained to manage this type of side effect. And if you look into the CARTITUDE-1 study, you can see that in the CARTITUDE-1 study, most of the cytokine release syndrome are mild, which are very well managed. It's kind of usual practice for them. Some of them can be severe, but in this case, physician and institution are using very potent drug early enough, and that's one of the learning of the cytokine release syndrome management, early enough to prevent the overdrive of the immune system in this case.